Next session will be on the heart failure, and we have three speakers who also, I would say, have put the Bangalore's heart failure scenario on a global map, including the transplant. So may I invite the chairpersons for the session 4 on heart failure, Professor K. Ravindranath sir, Professor S.T. Avgal sir, and Dr. Vivek Baliga to chair the session and take the proceedings forward. We have 4 speakers for this. May I request everybody to stick to the time and be brief.
Yeah. I think I have a couple of slides. Ejection fraction, revisiting the parameter. So we know, all of us, the universal definition of heart failure is symptoms and signs of heart failure caused by either structural or functional abnormality with at least elevated natriuretic peptides or objective evidence of pulmonary or systemic congestion. So we know the stages of heart failure. I will not go into the details. Those who are at risk of heart failure, stage B is already the patient has structural and functional abnormality with elevated natriuretic peptides, but it is called pre-heart failure. Then we have clinical symptoms. Already patient has heart failure with structural and functional abnormality. Stage is advanced heart failure. So now the ejection fraction is classified based on the, to say heart failure with reduced ejection fraction, it should be less than 40. So between 41 to 49, mildly reduced ejection fraction. The preserved ejection fraction is, if heart failure, the ejection fraction is more than 50. But sometimes if you look at the trials, preserved ejection fraction, deliver using dapagliflozin or emperor preserved, they used more than 40 as preserved ejection fraction. So there is one entity called what is heart failure with improved ejection fraction. Earlier it is called heart failure with recovered ejection fraction. So I will come to that. When the heart failure with improved ejection fraction means initially it is less than 40, but patient on treatment will increase more than 10 point or it is more than 40. That is the improved ejection fraction. So I will not go into the details of ejection fraction. It depends on the preload, afterload and contractility. So, okay. Now, preserved ejection fraction is not a single entity. It is various phenotypes of hypertension, coronary artery disease, atrial fibrillation, CKD, obesity, diabetes, OSA. See, it's all, you have to treat the underlying conditions with an appropriate guideline directed management. So, to diagnose heart failure with preserved ejection fraction, we have two. One is clinical, another is based on the echocardiographic data, morphological and biomarkers data. So, clinical, if a patient is hypertensive, obese, with atrial fibrillation, old age, more than 60 years, more or less you are diagnosing heart failure with a preserved ejection fraction. Why I told the heart failure with recovered, they have made improved, because once a patient is on treatment, you should not stop the treatment. This is only a remission. So this trial looked at those patients who are on heart failure treatment, when they stopped medication, there was 40% relapse. So we don't know how long you to continue, how to this. Again, there is other trial came. So only continuing with carvedilol and against those who are continued with the other drugs. So there was some single drug, beta blocker as shown in this particular trial. So there is reduction in the cardiovascular events. So of course now AI can detect EF based on your ECG. So ongoing studies are there, and even AI can detect giving the images. And even angiogram can detect ejection fraction. So this GLS is, see, before actually ejection fractions come down, subclinical LV dysfunction can be detected by GLS. So it's been established in the cancer chemotherapy to detect early and modify the drugs or stop the drugs. So, of course, in valvular RTD is ongoing, suppose patient has severe aortic stenosis. So, if before EF comes down, already sometimes because of fibrosis, there can be LV dysfunction. So, with this, I think we'll start the other, we have ongoing, they are talking about heart failure in detail, discussion can go on after that. Thank you.